Okay, so that's super annoying. I got a phone call and my video stopped. And I realized that I was already 7 minutes into it and I really don't want to redo all that. So I'll pick up where we left off. So they don't want to cut into each one of those veins and reattach them to the heart. So what they're going to do is they're going to cut into this confluence where all these veins converge. And they're going to cut some of the tissue plus the vein there, and they're going to reattach that to the back of his heart. And then they'll detach it from where it's currently improperly connected to the superior vena cava. So the problem with this is you have to be able to see precisely and exactly everything that you are cutting and everything that you are suturing. And so what that means is that circulation has to be stopped, even the heart and lung machine. And so what doctors do is during the surgery, they're going to look, Lucas's temperature is, his blood will be at 37 degrees Celsius. And so once they hook him up to the heart and lung machine, they'll drop his internal temperature to 18 degrees Celsius just to protect any damage to his brain and to his organs. And they are going to slowly stop his circulation. The doctor hopes that he can do this part of the procedure with incredibly minimal circulation, but there's a pretty decent chance that he's going to have to stop Lucas's complete and total circulation. And once he does that, he only has 40 minutes to complete this portion of the surgery before we begin to see potentially long-term impacts to the brain and seizures. And so this is a big one. This part of the surgery is the scary part, where they'll be completely stopping even the heart and lung machine circulating blood for Lucas for up to 40 minutes. After that, they're going to do what's called the Nikaido procedure. So step 1 was 40 minutes. Step 2 is going to be 2.5 to 3 hours. So the Nikaido procedure, our surgeon told us out of the 240 surgeries that he does a year, he'll do probably 1 Nikaido. And so the Nikaido is essentially getting these 2 arteries back to the appropriate side of the heart. And so again, the aorta is on the right side currently, and the pulmonary artery is on the left. And so those need to be switched. And so what doctors intend to do, since this pulmonary artery already has a narrowing or stenosis, they're going to completely just remove that, sacrifice that part. And they're going to cut the valve and the root of this artery, along with coming off the aorta, are what's called coronary arteries. These are the arteries that feed blood, because the heart is an organ. They feed blood back to the muscle of the heart tissue. They give it the necessary supply to be able to function and to pump. And so this is an incredibly precise procedure that you have to be able to move all of these things. And so what they're going to do is they are going to reconnect to the appropriate side of the heart. With the aorta. And make sure that the coronary arteries all maintain their appropriate attachments. They're then going to, with this pulmonary artery, they're then going to do one of two things. Depending on how far this gap is, they're either going to take some tissue that they've previously salvaged, that they will, at the very beginning of the surgery, salvage tissue from the surface of his heart. And they'll be able to use that to create a tunnel, if you will, back to the appropriate side of his heart. If not, if that's too far, then they'll have to introduce an artificial conduit that'll serve as the connection point. The doctors will then fix this VSD, or the hole in the wall between the two chambers, with some Gore-Tex to make sure that once Lucas's surgery is complete, the blood doesn't mix in his heart. And on the right side of the heart stays all the blood that has no oxygen, and on the left side of the heart is the blood that contains oxygen. The third and final step of the surgery is to fix this inferior vena cava connection and the ASD, and so the way that they're going to do that is rather than cut and remove this portion, they're actually just going to create a baffle. And so again, they're going to take some tissue previously salvaged from Lucas's heart, or they're going to use some more Gore-Tex, and they're just going to create a false wall, if you will, inside Lucas's heart, so that now this inferior vena cava is now pumping back to the correct side of the heart, and the right aorta and the left aorta are now separated, and blood will no longer mix. So I guess the last step of the surgery is that they're gonna install 3 wires. And they could be permanent, they could be temporary, but with all of this cutting through so the heart has a conduction system that tells that the brain tells the heart when to pump. And so once you begin to cut through the surface of the heart and through these septum walls, you begin to disturb that electrical circuit. And so there's a fairly significant concern that once they have Lucas's heart fixed, and they go to take him off of the heart and lung machine, that the electrical system will have been disrupted, and the brain will no longer be able to communicate efficiently with the heart, telling each portion when to pump in a good rhythm. And so they're going to install 3 wires so that if Lucas does develop heart block, they can attach him to a pacemaker, and he can have an artificial system telling his heart when to pump. So, man, I'm sorry. That's the best I can do. I appreciate all of you who just love us and care for us and pray for us. If that makes no sense, welcome to our world. We've been trying to wrap our heads around it for a year. We've had just an awesome staff and team up at Children's that have just done a super awesome job helping us just understand how we can support Lucas as best as we can. So thanks for loving us, and thanks for your prayers. That's it.